When we talk about high-density lipoproteins, it can be a little confusing to people, not in the medical field, because HDL or high-density lipoproteins are actually a good lipoprotein. Okay, it's the kind that we want more of. Okay, so our normal value for these high-density lipoproteins, or HDLs, is actually greater than, we want it to be greater than 60 milligrams per deciliter. So while we want our LDLs and our triglycerides and our total cholesterol to be lower, we actually want our HDLs, which are high-density lipoproteins, to be higher. So let's talk about what these are. Well, we have cholesterol in our body, right? We know we need cholesterol. Cholesterol is what helps make up the cell membrane, and cholesterol plays an important role in our body. But cholesterol has to be transported, right? Cholesterol has to be taken throughout the body. And the way that cholesterol is moved throughout the body is through lipoproteins. And HDLs, or high-density lipoproteins, are good because what they actually do is they travel through the blood and they pick up cholesterol and they take it back to the liver. So really, the HDLs actually are kind of like scavengers for cholesterol. They go throughout our blood, they go throughout our body, and they pick up cholesterol and they bring it back to the liver, rather than having it sit there in the blood and build up and cause plaque. Okay, so there's multiple types of lipoproteins. We have HDLs, we have LDLs, we have VLDLs. So the reason we're going to run our HDLs is going to be run as part of our total lipid profile. So with our lipid profile, we're going to get our total cholesterol, we're going to get our HDLs, our LDLs, our triglycerides. And the reason we're going to run it is to monitor for risk of heart disease or for risk of stroke. And so we want to know, what's our patient's total cholesterol? Do they have enough HDL? And do they have maybe too much LDL, too much total cholesterol? So these are going to increase these levels. Now remember, with HDL, we want it to be a little bit higher. So if there's familial HDL, that's a little bit higher, that could help. Exercise can help. Eating unsaturated fats, monounsaturated and polyunsaturated fats, can help. Some things that are going to decrease these levels. So remember, we want it to be higher. Some things that are going to decrease it are actually bad things. Again, that can sound confusing, but we want high HDL. So things that are going to decrease our HDL are going to be things like smoking, high saturated fats and trans fat diets, excessive body weight, hyperthyroidism. These things can cause our HDLs to go lower than what we actually want them to be. One way that I've been taught or heard to help you remember the HDLs are good is the word happy begins with H. So think happy cholesterol, happy lipoproteins. And so we actually want more of this. All right, so that's kind of what you need to know about HDL. That's what you can use to educate your patient on HDL, and I hope that helps.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE, and check out the free resources and other goodies that we have there, just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.